Hello, my name is Sean Crabtree, and I'm the Public Health Director of the Lake Cumberland District Health Department. I've been serving as the Executive Director for the Lake Cumberland District Health Department since January of 2001. Part of my responsibilities as Director is to facilitate orientation for new Board of Health members. Since we cover 10 counties and have 120 board members, doing this orientation in person is nearly impossible. Ergo, the need for this video. This video is intended to be a companion to our board orientation materials, which are available on our website. You can find these materials at www.lcdhd.org. Once there, from the main toolbar, click Tools and Info, then click Board of Health Member Resources, then click Board Orientation Materials. While watching this video today, you may hear several unfamiliar terms. Not to worry, each of these are expounded upon at the board orientation website that I just mentioned. Again, it can be found at www.lcdhd.org. Once there, from the main toolbar, click Tools and Info, then click Board of Health Member Resources, then click Board Orientation Materials. Let's begin with some history. On June 18, 1971, Dr. William McElwain, Commissioner of Health, sent out a memorandum which stated in part, "We are pleased to announce the establishment of the first District Health Department in the state of Kentucky, namely the Lake Cumberland District Health Department." The creation of this new legal entity joined together Clinton, Cumberland, McQuarrie, Pulaski, and Wayne into the first District Health Department, and it began on July 1st of 1971. In 1982, the counties of Adair, Casey, Greene, Russell, and Taylor joined the district, bringing the total member counties to 10. The area covered by the Lake Cumberland District Health Department is around 3,613 square miles. This is larger than the state of Rhode Island. We have the largest health district in the state by both geographic size and number of member counties. We are only one of two districts in the state that retain county membership from all of our original member counties. The population of our district is just over 200,000. The Lake Cumberland District Health Department is governed by a 30-member Board of Directors with representation from each county's local Board of Health. The governing board is commonly referred to as the District Board of Health, or just the District Board. The District Board is comprised of county judge executives, physicians, nurses, dentists, veterinarians, engineers, optometrists, and citizen members. The board employs an executive director, myself, and a medical director to manage the day-to-day operations of the department. Now that we've covered some history, let's review how the Lake Cumberland District Health Department engages with contemporary public health models. The Lake Cumberland District Health Department focuses on public and preventive health. We do so by offering on-site clinics, off-site programs, and by engaging our communities to adopt health-focused policies and initiatives. You can learn much more about our services by visiting our website at www.lcdhd.org and by clicking the Services link from the main toolbar. Our mission is to prevent illness and injury, promote good health practices, and to assure a safe environment. While pursuing our mission, we aspire toward excellence by endeavoring to practice according to the most contemporary and cutting-edge public health practice models. In delivering our services, we utilize research and outcomes-based programs as we strive toward fulfilling the 10 essential services of public health. Within all of our internal planning, we incorporate strategy within a framework of performance management. We utilize concepts of quality improvement as we complete both our internal agency enhancements and community health advancement projects. When training our staff, our workforce development plan looks to the core competencies of public health professionals and to the public health preparedness capabilities. In their oversight of our organization, the Lake Cumberland District Board of Health operates according to NALBO's 6 functions of public health governance. 10 essential services of public health. The 6 functions of public health governance. Perhaps these are new concepts to you. Not to worry, these are expounded upon by reviewing the materials and links from the board orientation page on our website. Again, that page can be found at www.lcdhd.org. Once there, from the main toolbar, click Tools and Info, then click Board of Health Member Resources, then click Board Orientation Materials. What are the duties of the local boards of health? KRS 212-850-2 says in part, when a district department of health is created, all powers and duties of the county boards of health, except as otherwise provided in KRS 212-920, under existing statutes are transferred to the district board of health. In short, this means that most of the power and authority of the health board is transferred from the local boards of health to the governing or district board of health. We will discuss what some of those duties are momentarily. But for now, what duties remain with the local board of health? KRS 212-9202 states that the trusteeship of the county public health tax funds shall be retained by each respective county board of health. But what does this mean? Well, in short, each local board still passes the local tax rate. This is the health tax portion of the annual local property taxes paid by each citizen. From these local taxes, the local or county boards provide 2.8 cents per $100 of assessed property value to the district for administration and for services. Monies generated beyond the 2.8 cents per $100 of assessed property value are used for local infrastructure needs such as buildings, parking lots, furnishings, heat and air. These funds are maintained in separate county accounts. Some of the local boards that have surplus local funds use them to fund local public health mini projects such as walking trails or park enhancements. The local board of health is also responsible for appointing some of its members to serve on the district or governing board of health. Therefore, each local board still has a voice on the governing board through their local appointments to the district board. Local board members are also encouraged to continue to provide public health support by serving on local county health coalitions, for example. Finally, all board members, whether you're a district board member or a local board member, all board members are encouraged to respond to legislative and policy calls to action by getting in touch with your state or federal elected officials and advocating for proactive public health policy. What are the duties of the district or governing board of health? As mentioned earlier, KRS 212-8502 transfers most of the local health board's authorities to the district or governing board. But what are some of these duties? Only the district board of health can adopt public health regulations. For example, authorizing the health department to adopt a syringe exchange program. Also, the district board of health is the board that approves the operational plan and budget for the agency. The district board of health also completes the director's performance evaluation. The district board of health oversees our day-to-day operations. The district board of health approves our agency's policies and procedures. They provide recommendations to the administration about future community or policy developments. The district board reviews financial statements for the agency. The district board is apprised of internal and external improvement projects of the health department. And as stated earlier, all board members are encouraged to respond to legislative and policy calls to action by getting in touch with state and federal elected officials to advocate for proactive public health policy. While there are other responsibilities associated with the governing board of health, This type of in-depth exploration goes beyond the scope of this video. Additional details can be found, however, at the board orientation page on our website. Again, that page can be found at www.lcdhd.org. Once there, from the main toolbar, click Tools and Info, then click Board of Health Member Resources, then click Board Orientation Materials. Regardless of if you are a new or a seasoned board member, use our website to familiarize yourself or to re-familiarize yourself with your roles and responsibilities as a Board of Health member. There's a variety of other resources available on our orientation page. Some of these include links to the KRSs and KARs that govern health departments in Kentucky. There's additional orientation materials from the National Association of Local Boards of Health and from the Department for Public Health. There's an explanation of the 6 functions of public health governance, which are policy development, resource stewardship, legal authority, partner engagement, continuous improvement, and oversight. There's also information about the core competencies of public health staff. Also on the site, there's the Board Code of Ethics and the District Board of Health bylaws. As we conclude this video, I encourage you to feel free to contact me with any questions you may have. Again, this video is intended to be a compendium to our board orientation materials, which are available on our website at www.lcdhd.org. Again, once you come to our homepage, from the main toolbar, click Tools and Info, then click Board of Health Member Resources, then click Board Orientation Materials. Thank you for taking the time to watch this video.